Okay. Thanks everybody for joining. My name is Shun Foreman. I am the founder of Sugar Mode Off. And from the month of February through May, I've been super excited to host the Sugar Free Book Club. And of course, this month we've got Dr. Georgia Ede. We've been working on her book. We're not done, Dr. Ede. Just to let you know, we're not done. It's called Change Your Diet, Change Your Mind. And just a little bit of a background from about who Dr. Georgia Ede is. She is a Harvard trained psychiatrist who specializes in nutrition science, brain metabolism, and mental health. Dr. Ede is widely known and recognized for numerous accolades. The book is just one of them. I think she's actually been a co-author of another book. In my opinion, I wish this book were in nursing schools and
Mm.
in medical schools, and that it should be taught like a curriculum. I mean, I think really this is one semester's worth of work in this book. So I'm super excited to have her here. And I think if we all make this 1 hour go as fast as I think it can go, we should just be able to pour in our questions and ask her, how does this whole food thing affect our mood? So thank you, Dr. Ede. If you don't mind just stepping in and just telling us a little bit more about yourself.
Yeah, I mean, so first of all, since this is a nice small group where we'll be just chatting and talking about questions, please feel free to call me Georgia. And second of all, that's a very nice introduction you already gave. So I'm a psychiatrist and I practice in Eastern Massachusetts, which is where I grew up. And I've been a psychiatrist for 25 years. And the first 10 years of those, I did kind of regular psychiatry, medications and therapy, and that was all. I really enjoyed it, but most of my patients weren't getting that much better. So and then when I kind of stumbled into nutrition, which was my own health issues, I started studying nutrition for the first time, and became fascinated by food and the brain and how those two things fit together, and just came across all of this upside down information about nutrition that completely took me by surprise. I mean, most of what we are told is good for us, most of it's upside down and backwards. And so it's kind of amazing what you can do for yourself if you have the right information. You can feel so much better, and protect yourself from all kinds of physical health issues and mental health issues just by feeding your body the right way. So um, I love talking about this stuff and I love answering people's questions. So we can just, whenever you feel ready, Shun, we can dive right in if anyone wants to ask anything.
I just say if you all want to just go ahead and just dive in and ask your questions, I've got a ton, but this is not about me. I'm going to read this book. It's going to take another probably 6 weeks for me to get through the book and get through it thoroughly. So if whoever wants to go first, just go right for it.
I'll start. I don't even really have an exact question. It's just I was so blown away by this book, and I've read so much stuff out there. I've, read everything I could get my hands on, like I can't even think of them all now, but Metabolical by Dr. Lustig, and all Mark Hyman's books, and Ben Bickman and Jason Fung, and learning more and more about the brain and insulin resistance. But the things that really blew me away were probably in chapters 12 and 13 with the specific problems with eating the plant foods. Some of that I had heard before, but not very much. I'd kind of heard about soaking nuts or something like that. I thought, who's going to bother to do that? They're good for me. How much am I really doing if I soak those? So I have a hard time explaining, the whole insulin resistance thing to my friends and family who are interested in what I'm doing. And I just feel like if I start saying, eat mostly meat, they're just, I don't even know how to talk about it. But I loved, you're very methodical laying out of it. It makes so much sense.
Well, first of all, Shirley, thanks a lot for reading the book and for I'm glad that you got a lot of interesting things out of it, even though sounds like you've already read a lot about these topics. So I'm glad that there was something new in here for you or interesting for you, given how educated you already are. So that's good. I'm glad. And yeah, I mean the plant food, the plants and animal foods, all of that I find really fascinating, and I love thinking about it. And so, and it really is, like you said, it's most people, I think if they understood how upside down it is, I mean, it's just so hard for people to absorb because we've been taught for decades that plants are good and animals are bad, and the more plants you eat, the better, and the less meat you eat, the better off you are. And it's almost exactly upside down from that, the truth. And so it's not that it's not that most fruits and vegetables are bad for us. I mean, we've been eating them forever and ever. Maybe not exactly the way we do now, but it's not really. But what's so interesting to me is that all the science about meat is so it's what's the right word for this? I don't want to use an alarming term, but I think it's almost as if people are looking for reasons, trying to do experiments to try to show that meat is bad, but because they don't want to find out that it's good, they design the experiments so strangely that you can't even tell what's going on. And so I was just really genuinely surprised to find that there is just not a shred of evidence that meat is bad for us, but that somehow that's what we're all taught to believe. And so when you say, how do you talk to your friends or your family about it? That's a tough one, because I think, we're really attached to our beliefs.
I know you talk about this in the book, but I think part of it is a lot of us are aware of what, the contained animal feeding operations do to the environment and how terrible the animals are fed with, hormones, and at least in the US and things like that. And I don't really want to eat that meat either. But the science that you described just goes beyond that. So I'm sure other people have things they want to say, but I just wanted to put out there that those two chapters are the ones I keep reading, trying to. Well, the other thing I'll say is fiber. I've just heard fiber for your microbiome. And I am finding in my own sugar-free and processed food-free journey that it doesn't seem to matter. When I tried to fix my digestive problems by eating a lot of fiber, it didn't do anything.
Sometimes it can make things worse, actually.
Yeah, and now it's just, so a lot of things I thought were true just turned on their heads.
Yeah, and so those chapters that you're talking about, I think 12 and 13, if I'm not mistaken, I think that's the chapter about grains, beans, nuts, and seeds, and the chapter about
Yes,
fruits and vegetables.
exactly.
Yeah, so I those are if I could have written a whole book just about about that would have been a lot of fun.
Yeah.
But no, I'm glad that you found those interesting. I mean, especially the grains and the beans that we're told are supposed to be the foundation of our diet. I think that they really haven't earned that place. I mean, they really don't deserve to be the foundation of the diet. They're really just doing almost nothing for us, and lots of risks involved in eating those foods. So it's just so funny how upside down it is. But yeah, thanks anyway
Yes.
for
And Shirley, if you don't mind, just tell us where you're from, where you're calling
Oh,
from.
yeah, I'm in Madison, Wisconsin.
There you go.
Madison. Yeah.
Okay.
Yeah.
Okay. If you all want to drop whether or not you have a question or not in the chat, that's fine. We can go that way. If you want to just say hey or raise your hand or whatever, we can just go for it. Whoever's next, you're up. Yes, Miss Joanne. Tell her where you're
I can't
from.
find where to post a hand.
That's okay.
So yeah, one thing that I want to say is, as Shun was saying, it should be a textbook. I'm feeling overwhelmed trying to read it very quickly, and I'm not very good at learning biology. So I'm finding it overwhelming. But I realize that it would be very useful as a textbook for medical practitioners. So yeah. I have a number of questions, but one tiny observation is that I noticed that you classify cholesterol as a macronutrient.
Oh, yeah.
It's completely novel. I've never seen anybody else uh, put it that way.
What do you do? What's your background, Joanne?
I'm retired. I was in administration. I'm in Ottawa, Canada.
In Ottawa. Okay, great. Yeah, so it's interesting that you noticed that because I was wondering if you had a science background because a lot of people, I mean, that is a strange thing that I did. Normally the macronutrients are usually considered to be protein, fat, and carbohydrate. And I also threw cholesterol in there. And I did that on purpose because if carbohydrate, which is completely, which we can make ourselves and we don't have to eat, if that can be a macronutrient, then so can cholesterol, because cholesterol we can make ourselves and we don't technically have to eat it. So if carbohydrate, which is completely unnecessary, can be a macronutrient, then I think cholesterol can be too. So that's they're both really important molecules. We can't live without these molecules, and they're, when I think of a macronutrient, I think of, a nutrient that is required by the body in large amounts. And we require large amounts of cholesterol. Every cell has to have cholesterol in. Every cell needs glucose, and lots of different parts of cells are made from glucose, pieces of glucose. So I feel like there is really no difference there. And I kind of did that on purpose, but I didn't know if anybody would notice. So thank you for noticing.
Great question too. I think Roz has got her hand up.
Okay, good evening, everybody, and thank you, Dr. Ede, for joining us tonight. My question, I have several questions also, but I'll start with one, and hopefully throughout this session, I'll have an opportunity to maybe ask the other questions. But Dr. Ede, are there factors or are there things about individuals that make certain diets better, or are there situations with our medical history? Are there situations with any diagnosis that we may have had in the past? Are there situations about just anything specific about us as individuals that would make any one of the diets that you recommend better for certain individuals?
Wow, Roz, that's a great question. So first of all, where are you located? Where are you joining us from? Are you still
Oh,
there?
yes, I forgot that part. Thank you, Dr. Ede. I'm retired and I'm living in St. Louis, Missouri.
Oh, fantastic. So great. No, this is a really great question. Because we're told all the time, well, if you have this condition, you need to eat this special diet. If you have this condition, you need to eat that special diet. Or you have a kidney issue, then you want to eat a low protein diet. Or if you have heart disease, you want to eat a low fat diet. And so that's a pretty common way of thinking about things. But the way you asked the question was great because because I just loved it, because really the way to eat for all of us, so we all have the same basic nutritional needs. We all need, we all need to have a certain set of vitamins and minerals, and we all need protein, and we all need a certain amount of fat and certain types of fat. And we can get away without carbohydrate. That's optional because we can make it ourselves inside our bodies, or we can eat it from outside our bodies, right? So we need those pieces, and then we need all the vitamins and minerals so that we can run the chemical reactions in our body. So we all have the same needs. When we need water and we need sunlight, so we need these things. But then once the body, as you were saying, once the body has gotten some damage, then, for example, if you have a health issue, specific health issue in your past or now, then it gets different. So if we're all healthy, if everything's working well and we're really healthy, then we should be able to eat. All of us should be able to do well on, this is my thinking about it anyway, on basically kind of a paleo type diet, right? Kind of a hunter-gatherer diet that, we evolved over, a couple of million years to eat. And that's, animal foods and, basically whole plant and animal foods. Not the grains or the beans necessarily, but, eggs and poultry and meat and seafood and nuts and seeds and fruits and vegetables, that sort of a pattern. That should be good for all of us. But then once you have something go wrong, you may lose a lot of your ability to safely process a significant amount of carbohydrate. And so, and that's now most of us. So now most of us that have, this thing called insulin resistance or pre-diabetes or damaged carbohydrate metabolism, whatever you want to call it, for including myself, though, even those whole food carbohydrates like fruits and vegetables, we have a really limited ability to process safely. So for more than half of us, it's better for us to cut down on our carbohydrates, and often we need to cut them down by a lot. And quite a few of us even need to eat a very low carbohydrate ketogenic diet to keep our metabolism healthy and keep our glucose and insulin levels under control and energize our cells and feel well. So, and that's lots of people. And another piece to that question is, oftentimes you'll hear people say, oh, I have kidney disease, or I have gout, or I have, high cholesterol. And so I'm supposed to eat a low fat diet, or I'm supposed to eat a low cholesterol diet. Or in case of kidney disease, people will even be told they're supposed to eat a low protein diet. And that's almost never true. So, it's really the carbohydrates where you want to pay attention. That's the big difference between most of us now. Is our ability to process carbohydrates. So quite a few of us do have to eat differently than we were originally designed to do. Is that what you were asking?
Yes, yes, yes,
Okay.
yes.
Yeah, and none of us needs to eat a low cholesterol diet. None of us needs to eat a low fat diet. None of us needs to eat a low protein diet unless you have severe kidney damage, where the kidney's ability to process protein is really severely impaired. Then you may need to cut back on your protein. But in all other cases, all of these are safe. The other exception is if you have a lot of weight to lose, if you have some extra body fat and you're trying to lose that, you may choose to eat a lower fat diet as well, but the carbohydrates are the most important. Cut those carbohydrates down, that's the most important. But then if you're having trouble losing weight, you may need to cut back on the fat as well until you reach your happy weight, and then you can eat more normally again. So those are the two exceptions I can think of.
Thank
Wow.
you. Thank you.
Yeah, great
That's
question.
good stuff. Okay, who's next? Chime in. If you don't, I will. I'm going to use this opportunity to ask you about oxidative stress.
Sure.
I always say when an author puts a word in a book more than 5 times, then that's what I need to focus on. So if a patient came to you and did not know anything about oxidative stress, but it kind of sounded okay because they heard you on, the news, and they said she kept talking about oxidative stress, what would you tell them in layman's terms?
Yeah, that's great because we hear about antioxidants all the time. I think most people have heard that word. Oh, you have to eat this colorful plant food that's loaded with antioxidants, or you have to take this antioxidant supplement. And antioxidants, cancer-fighting antioxidants, and brain protecting antioxidants. So we hear that all the time, but we never talk about what are those antioxidants doing? What are they? Antioxidant? Why do we need so many of these things? So what we're not talking about is is the antioxidants are supposed to fight something called oxidative stress, which I guess I did write more than 5 times in the book. So oxidative stress is a perfectly normal and natural thing that happens in cells. So when cells are trying to turn food into energy, so when they're trying to turn like glucose or blood sugar into energy, or if they're trying to turn fat or ketones into energy, they have to break those molecules apart to get the energy out. And when they do that, that requires oxygen. And so as you're breaking those molecules apart and taking out their energy, the oxygen it has to get broken in half, and then it's very reactive, and it can kind of spill over and terrorize the village. So it can kind of randomly bump into things and damage things kind of willy-nilly, like a bull in a china shop, right? When you're using oxygen, what you need to do to pull that energy out, there's a little bit of risk involved because the oxygen can get loose and cause damage. And that's called oxidative stress. But that's perfectly normal and natural. Like Mother Nature knows that, okay, in order to get this energy out, we're going to have to break open some oxygen. And that oxygen is it has a mind of its own, and it might cause some damage. So Mother Nature very wisely gave all of our cells their own antioxidants, really powerful ones to deal with that oxidative stress that she knows we are going to be seeing every time we eat. And we also get oxidative stress from, this radiation from the sun. And we can get oxidative stress from cigarette smoking. And we can get oxidative stress from drinking alcohol. But the biggest source of oxidative stress in our lives is refined carbohydrates and vegetable oils. So if you're eating the right way, your own antioxidants inside your cells will do a beautiful job of mopping up those oxygen, they're called oxygen free radicals, those kind of oxygen bulls in a china shop. Your own cells will take care of that for you. But if you overwhelm your cells with all of these damaging ingredients, if you smoke too much, if you drink too much, if you overexpose yourself to sun, if you eat refined carbohydrates like sugar and flour and cereals and fruit juice 3, 4, 5, 6 times a day, which is what most of us do, and a lot of vegetable oil, you're going to overwhelm that system, and your own antioxidants are not going to be able to keep up. And those oxidative oxygen, those damaging oxygen pieces are going to spill over into the neighborhood and terrorize the village. So and it's very damaging. It can damage your DNA, it can damage your cells, it can damage all the important components inside. And so it really is, including in the brain, and it can literally cause brain damage from the inside out. So the antioxidant foods that we're told to eat, these colorful plant foods, they do contain antioxidants, but those antioxidants don't only work in plants. They don't really work in humans. So they do contain them, but good luck getting access to them and having them work for you. What you really want is to be able to rely on your own internal antioxidants, and we're not usually told, oh, stop eating the things that are causing the oxidative stress in the first place. So that's what that's all
Okay, I hope you're taking patients in Texas from Texas.
about.
So I'm signing up. I am signing up. I think Leslie has a question. Leslie, you're up.
I'm not sure. I just slid into this desk, not even sure if my camera's going on. Yeah, my
There
work
you are.
background. Hi, hi. So I'm from Houston. Um, Good AC1, healthy, no pre-diabetic, but every time I go low carb or keto, even if it's just sort of a temporary thing to feel better, knock off a few pounds, I feel terrible. What am I doing wrong? Or do some people just not do low carb well?
So I have a few questions for you. Well, let me answer and then ask you questions. So the first question is, just about everybody, unless you have some sort of rare genetic disorder of metabolism, something that you were born with that makes it hard for you to burn fat for energy, just about everybody can do a low carbohydrate diet and adapt to it. the devil is in the details in terms of how you start it and how and then how long you give it. So I was curious to know, how did you start it? When you start it, how do you do that? And then how long, what's the longest you've ever done it for?
Probably 2 weeks, and I probably rush into it. So how do you start it?
So that's super encouraging and hopeful, Leslie, because those are the two biggest problems with switching over to low carb diet, is either jumping into it too fast, which is a huge shock to the brain and the body and can cause people to feel just miserable, which it sounds like you've experienced. And the other thing is not giving it enough time. So you want to start slowly, very gradually,
Okay.
to give your body time to kind of ramp down those glucose and insulin levels gradually, so that you can ease yourself into it. You can take 2 weeks or more to do that. And there's a strategy in the book that I suggest that, for example, asking people to start with something called a quiet paleo plan, which is in the book as a step one, which is it's a paleo diet, but it's been modified in these certain special ways. But then it also is much lower in carbohydrate than a typical paleo diet. So it's about 90 grams of carbohydrate a day,
Okay.
as opposed to a ketogenic diet, which is usually more like 20 grams a day.
Okay.
So that's one way. And then the other thing is once you do shift over to low carb, once you get down into the ketogenic range, is to give it some time. So it can take 2 to 6 weeks for your cells to feel comfortable and to get good at burning fat for energy. So there is this transition period, which can sometimes just be frustrating. But there are lots of tips in the book. In the chapter's the ketogenic diet chapter. I can't remember the number of the chapter, but at the whole last part of the book is these different diet plans, and one of them is a ketogenic diet. And there's a lot of tips in that chapter about other things you can do to make that transition more comfortable. And one of the
Okay.
biggest ones is electrolyte supplementation, making sure you're getting enough salt,
Okay.
sodium, potassium, and enough water so that you're staying well hydrated. And then the other piece of the puzzle is, whether or not you're taking any medicines, because there are some medicines that can make it more complicated, and there are some health issues that can make it more complicated. So, but if you're healthy, normal blood, you don't have blood pressure issues or heart disease issues or a history of diabetes, and you're not taking any prescription medicines, then it shouldn't be too challenging. You just have to know a few basics,
Okay.
how to start it and how long to give it.
Are you staying in a state of ketosis all the time, or do you do low carb, or do you go in and out?
Yeah, so yes and yes. So basically,
What do you do?
I've been eating a ketogenic diet for the better part of, when did I start? 2012. So 12 years,
Um,
not perfectly. And I've certainly had my, and I want to fully acknowledge that. I mean, but it doesn't have to be perfect, right? So I have my days, or I have my, I take my days off, or I have my holidays or things. I always pay a price for it. But, I'm not perfect about it. But over the years, I've gotten much, much, much better at going really long periods of time without having any issues sticking to it. I've actually found that, so, I can go months and months at a time and being ketosis every single day. But I have my days, but I also know lots of tips and tricks for getting right back on the
okay.
next day, which is really important. But the other thing I wanted to say about that was that, for people who are using ketogenic diets for weight loss, which is not the point of the book, the point of the book is mental health. But the good news is that also helps with weight loss if you're trying to lose weight. You can actually even gain weight on a ketogenic diet if you design it the right way, or stay the same. You don't have to lose weight on keto, but most people are trying to lose weight, right? So, and I've had a weight problem my entire life since I was, in the first grade. So, this is the only diet, and I've been on every diet. It's the only diet that I've been able to maintain for any length of time with any, I mean, it's just so much easier than other diets because you're not as hungry and you really feel satisfied and you really feel good. And you feel like you get this suit of armor when you walk into a room where there's, cookies or candy or cake, whatever it is. they don't call to me in the same way. And because I'm feeling satisfied. And
Yeah.
so it is a lot easier, I think, than low calorie diets or low fat diets.
Okay. Shun, I have one more question. Is that okay?
Before you ask your question, I have to say that Leslie is the founder of this book club.
Oh,
So
yes,
she
Leslie.
probably don't want to take credit right now, but she is the brilliant mind behind
Oh,
the
goodness.
Sugar-Free Book Club. So I have to say that. But yes, go ahead with your next question.
Okay. I have
Thank
one
you,
more question, and then I have some praise for your book. If you're trying to monitor your ketosis or low carb with a CGM, a continuous glucose monitor, I've been playing around with one.
Yeah.
Do you kind of want it to stay in a range between, 80 and 100? Like, what would be a good range to try to keep it in?
Yep. So in chapter, I think it's 7. I sometimes I get the numbers mixed up, but
Okay.
in chapter 7, I describe exactly what you want to see. What you want to see your fasting blood sugar look like, what you want to see your after meal glucose look like, and what
Perfect.
you want to see, and what you want the pattern to look like. So essentially, just to kind of cut right to the chase, there's lots of information in that chapter, but you really never want your glucose to be 140 or above. And it's even better if it doesn't go above 125, even after
Perfect.
meals.
Okay.
Ideally, on a good ketogenic diet, you won't see it go above 110, even after meals.
Perfect.
Yeah.
Okay. So my feedback real quick is I have the book, but I'm not as able to keep up with the ladies. I've been much slower. So I kind of skimmed through it, and now I'm going back and I'm just like reading every page, because like even the flaxseed and the cyanide, I mean, there's so many, like you think you know it all, and there's so much amazing information. So I just wanted to tell you that. And then I kind of cheated. I listened to a great podcast with you. There's some great YouTube interviews. So ladies, Google her. There's some great interviews, and you learn a lot of stuff too. But yeah, you got to really dig into the book, I think, to get all of them. But we really appreciate you, and the book is amazing. So thank you so much.
Well, thank you for taking the time to dive into it. And I'm so glad that you're finding it useful. I mean, again, the people in this group are clearly well educated about nutrition, and I can tell by the questions that are being asked. And so it makes me really happy to know that the book is bringing new things, new pieces of information, hopefully helpful pieces of information. And it was actually pretty challenging to find that balance between science and making it accessible to as many people as possible. So I know it's not, it's not something you can maybe read in a couple of hours, but hopefully for most people, they'll be able to read the parts that are most important to them. And there's a chapter or two there which has a lot of science in it, and feel free to skip those if you,
Yeah. Yeah.
if you're not into that. But that was challenging. So I hope it's not
No, it's perfect. It's really great. Yeah. It's just there's so much information in there. I want to go a little slow.
Well, thank you. I'm glad you're finding it useful.
That's it. I'm good, Shun. Thank you.
Awesome. You are awesome. I'm putting this up again just because this is what everybody who looks at this on YouTube, they need to see this, that this is the book. I'm going to say it again, that this is a curriculum. It like literally it should be taught somewhere in a school, and it probably would take longer than a semester to get through it, but I could see myself really wanting to, go deeper and deeper into this book over a period of a semester. So I'm just going to highlight what you just said, Leslie. I'm with you. I think oh, you said you were from Houston, so she knows that. How about Deb Reynolds? You are free to roam.
Hi, Deb. Can you hear us?
I can. I put my question in the chat because my brain isn't functioning that well. But I'll read it to you. I haven't been able to read the book yet, so you may cover this. I'm not sure.
Okay.
Are there diet implications for people who take antidepressants? For me specifically, I take Hintrelix and Wellbutrin.
Yeah, so that's a great question, because I mean, generally speaking, those are both antidepressants, and they really don't pose any special concerns on these special diets. So if you were going to try, for example, a quiet paleo diet, which is one of the step one in the book, or even if you were going to try a quiet ketogenic diet, which is also in the book, or even a carnivore diet, those medicines are pretty easy to work with, meaning you don't need to check any blood levels. You don't need to worry that, when you switch to the diet, that the medicines are going to start to, that are going to reach toxic levels, or that the level is going to drop. There are other medicines where that's not the case. So there are some medicines where you do need to check levels, and you do need to pay careful attention to as you're switching over to the diet, because the medicines will be affected. What I would say, though, is that even the antidepressants can start to feel, if you're going to try a ketogenic diet at some point in your journey, that you'd want to watch out as you're switching over to the diet, and you want to work with your prescriber on this, and maybe somebody who has some experience with ketogenic diets as a coach or dietitian, or somebody else on the team can work with you, because as you're switching to the diet, your whole chemistry changes. I mean, the ketogenic diet is a powerful biological intervention, which is exactly what you want. You want a dietary intervention that's going to be powerful and really help you and really work. And that's going to change your brain chemistry. That's what you want. And it's a good thing. But when it changes brain chemistry and body chemistry, the medicines can start to feel too strong. And so over the first few weeks, you can even notice this as early as the third week of a ketogenic diet. You can start to feel like, well, the dose is too strong, right? You might get side effects that you didn't have before, or you might get side effects that you remember from that day when you accidentally took a double dose of the medicine, right? It'll just feel too strong. And so whoever is prescribing those medicines for you is going to need to work with you, if that happens, to gradually lower the dosage of those medicines. And it's very individualized. So it's not as though I couldn't write in the book exactly how to do this, because it's so different from one person to the next.
Yeah.
Wow.
Okay.
That's,
Thank you.
and where are you calling in from, Deb?
Oh, yeah.
I live in Newfoundland, Canada.
Oh, my goodness.
There you
Wow.
go.
I know one thing about Newfoundland,
Yeah.
which is that I heard that you have some wonderfully colorful expressions up there for things. And so is it true that people say when their hair is messy that they're all mops and brooms?
There is a whole dictionary of Newfoundland English. So yes, it is a very colorful province in many ways.
Oh, thanks.
Yeah.
I love that. Thanks.
And we have lots of connections in Boston, because a lot of Newfoundlanders sailed to Boston and Massachusetts. So we've always felt very connected to that area.
Oh, that's fantastic. Well, we have our own colorful expressions in Massachusetts too, but
Yes, yes.
not all of them I'd want to share, in public.
Same here. Yeah. Thanks.
Thank you.
Thank you, Deb. Who's next?
So I have an extra question. This is Roz.
Hi, Roz.
I just want to say that I did have a personal experience with my thyroid medication because I've been on my sugar mode off journey for almost a couple of years, which means that I really have reduced carbs. So I know what it's like to have my medication reduced, which was good for me. But I wanted to ask you, Dr. Eid, about about sesame seed oil.
Oh, what about it?
What are your thoughts about sesame seed oil, either toasted or just regular sesame seed oil?
Well, it tastes and smells delicious. I mean, I will say that. So, that's an interesting question, because I have to look back. Give me a second. I think that is one of the oils that is a little higher in linoleic acid. Let me just take a look through the book. Which chapter would that be in?
It's chapter 6, I believe.
Okay.
I think we were on chapter 6.
I have a
Yes, chapter
table.
6, 103,
Thank
or
you. Yeah.
that's
So
okay. 101 is the table.
thank you very, very much. I think sesame oil is there. Yeah. So this is the table in the book.
Mhm.
Let's see, people can see that. And the table in the book shows you how much linoleic acid is in each type of oil. And linoleic acid is a risky fatty acid. So you don't want to have much of it in your diet. It's okay to have a little bit. We're designed to see a little bit from whole, nuts and seeds and things like that. We're not designed to, pour large quantities of it over all of our foods all day long, right? Which is what's happening with vegetable oils. So the sesame oil on this chart, the linoleic acid is a little over 40% of the fat in the sesame oil is linoleic acid. So that is on the higher side. So, but the good news I think I would say about sesame oil is most people use it more like a condiment as opposed, they might just use it a little bit to flavor a sauce or maybe drizzle it on vegetables, or if they're, kind of making, especially in Asian cooking, it's very commonly used. So if you're not using too much, maybe it's okay, but just be aware that it does contain high amounts of linoleic acid. And so you don't want to use too much because linoleic acid is one of the things that can cause oxidative stress in the body.
Okay.
And the brain.
And where does olive oil rate?
Olive oil is low. Olive oil is low. So olive oil is one of the oils, especially you want to look for extra virgin olive oil, unrefined, first cold pressed, that sort of thing. The highest quality olive oil you can find. But even low quality olive oils, as long as they're not mixed with other oils, because you can see that sometimes some of the manufacturers will mix other oils in. But if you get a good quality olive oil, that's one of the good oils that you can use.
Thank you. Thank you.
Thanks, great question.
Okay. Thank you so much. I think Joanne has a question.
Hey, Joanne.
Actually, it's a follow-up question because we were discussing sesame in yesterday's meeting, sesame and tahini. And I remembered that Dr. Nick Norwitz was saying that he eats a lot of tahini. And I looked it up, and in their book about the Mediterranean keto diet,
Yeah.
he says that there's something special. There's a special rule about sesame because studies have shown that there's, let me see, there's a reverse oxidative stress effect with the sesame because it contains three anti-inflammatory components. Let me find them. He calls them the terrific trio. Sorry. Sesamin, sesamolin, and sesamol. So I guess maybe I'm rationalizing because I really like tahini and I've been having tahini. So maybe I'm rationalizing that, I want to find a reason to be allowed to eat more than. So, but yeah, 40% linoleic acid is a pretty high content, isn't it?
Well, that's fascinating, Joanne. I didn't know that, and so, and I know Nick, and he's a very, very smart person, and so I will need to look into this because I hadn't been aware of that. So thank you for challenging me and pushing my brain to get bigger.
You never know.
Okay, other questions? Any other questions? I'm sure you do.
Topaz, looks like Topaz has a question.
Yes,
So
Topaz, go
actually,
for it.
oh, I'll let Topaz go first.
Yes,
Hello.
go for it.
So my issue is PCOS. So I've dealt with, to my knowledge, what I've read up on PCOS, I've pretty much dealt with every aspect of it, from the hirsutism to the diabetes to a lot of things. So I was just kind of wondering, was there a specific diet, routine or diet type that you feel just kind of works better for people dealing with PCOS? I've been trying to cut back on my baked goods because I'm a baked goods girl. I'm not really so much as candy. unless I'm truly fiending for something sweet and I can't get my hands on baked goods. But lately I've been trying to find different ways to, get my sweets without having baked goods, looking for more natural fruit, fruit chocolate, because I'm a chocolate person. So I was just kind of wondering, like, if you had any suggestions about that.
Wow, thank you for asking that, Chubba. Where are you? Where are you from? Where are you located?
I am in Dallas, Texas.
That's great. So I love this question because so PCOS, for folks who might not know what that is, it's polycystic ovarian syndrome, and it's becoming more and more common among women. And what it is the ovaries can start to kind of be overactive and start to make lots of cysts, and that can throw off your menstrual cycles, and it can cause excessive hair growth, and it can even cause infertility, difficulty getting pregnant, and cause weight gain and all kinds of other very frustrating and unhealthy things. So, and I actually have a family member who had PCOS until they changed their diet, and it's completely gone. So, and this is there's good research on PCOS and diet, because the thing about PCOS that's so clear in the science is that what's driving that PCOS, that the ovaries to become overactive in that way, is high insulin levels. So it's very, very clear in the science on this. So when insulin levels are too high, that can cause a woman to develop PCOS if she has that tendency in her family, right? So and so the key to treating that PCOS and getting your hormones and your ovaries and your cycles and your what the other thing happens is your testosterone levels can go up on PCOS. It throws all your hormones off, right? So the key to treating the PCOS is getting your insulin levels down. And the thing that raises insulin the most are carbohydrates, especially the refined carbohydrates. So, and that's the sugars, the flours, the syrups, and the crystals, and the and the cereals, and grains, and beans, and all the starchy and sweet foods that we all love. So, I mean, first of all, I really identify with you as being a starch person rather than a sugar person. So you could lock me in a room full of, candy, and I would be just fine. If you lock me in a room full of, I don't know, cornbread, I'm, that's more challenging. So, I'm not a sweet person, a starch person, but it's all the same. The body can't tell the difference between flour and sugar. It's just all naked glucose molecule. It's just all naked carbohydrates that have had their fiber and they're stripped away, and they turn instantly into glucose in the bloodstream. The body does not know whether you've just eaten flour or just eaten sugar. They're the same. And the same is true of white rice, and the same is true of, fruit juice. Like the body just can't tell. So they're all really spiking your insulin levels and causing those hormonal shifts that are influencing the function of the ovaries and your hormonal balance. So one of the best diets for PCOS is actually a ketogenic diet, which is extremely low in carbohydrate. But but not everybody needs to go to that length. The key is getting your fasting insulin levels tested, which is really easy to do. So not your fasting glucose, although that's fine. It's fine to do that. But what you really want to know is your fasting insulin levels. And so with PCOS, they're usually quite high. So what you want to do is you can either ask your doctor, your nurse practitioner to check that for you, to order that test and get that. And it's just a simple blood test. Or if they, for whatever reason, don't want to check it, you can even order it yourself through an online lab, one of these consumer labs. Unfortunately, you'd have to pay, insurance won't cover it if you order it yourself, but it's usually only about $10, $12 to get a fasting insulin level. And if that fasting insulin level is 10 or above, that's a very strong sign that you have insulin resistance that's probably driving that PCOS process. So that would be what I would recommend. I'm not a psychiatrist. I can't give you like more medical advice than that. But that would be where I would start.
That
Okay.
is great.
I
Great
will
information.
the information because it's so confusing. Like, I feel like I know what I'm supposed to eat. I've lost weight before, but because I'm 44
Yeah.
and I don't have any kids. I don't drink juice. I don't drink sodas. I'm really kind of more of a coffee or water or tea, and it's not the pre-sweetened teas. Most of the stuff I buy, I try not to buy any foods that have any added sugars. So I
Great.
do pay attention to how much sugar is in everything that I buy. If it's like, something with fruit and it has added sugar, I just don't even buy it. So I've been really trying to pay more attention to how many carbs is in something. And I
Good.
call myself a carbivore because I love bread, I love potatoes, I love brownies, cakes, everything, like I said, baked good cornbread. I could eat that.
Yes, Topaz, you gotta get the book. We gotta keep talking about this book. We gotta keep talking about this book. We've got only 6 more minutes, y'all. I knew this time was gonna go by quickly. We have a few people that just joined in. I think Beth Hicks just joined. Does anyone have any questions?
Can
Because
I
I've
ask
got,
one last question for
l-
Dr. E?
let me see if someone else has a question first.
Okay.
Just give me one more second. Anyone else have questions? Just making sure, being fair, because I'm telling you, I could hog all this time up. Okay, go for it, Roz.
Uh, so it may be personal, Dr. E. I hope not, but I'm just really curious if you would be willing to share what your meals look like. For example, if you eat breakfast, what is it? If you eat lunch, what is it? If you eat dinner, would you mind sharing what your meals look like when you have your meals?
Oh, not at all. That's absolutely, I'm happy to share that. So for example, today, so I usually try not to eat in the morning. When I wake up in the morning, I try to delay my first meal of the day until 11 or 12 o'clock to give my body some more time in fat burning mode and to give my body more healing time, that break from food processing. And then I usually start to get hungry around, 11, 12, something like that. And I'll have one meal at that point, and then later on around 4-ish, 5-ish is when I'll usually have a second meal. I try not to snack between meals. This all kind of goes out the window when I'm traveling, but when I'm on my usual schedule, that works really well for me. And I would say, I've gone through different versions of my diet, but right now what I'm doing is probably 95% carnivore. So for example, today, all I've had to eat so far has been a steak that I had at 11 o'clock. And I think I had some coffee this morning, about that much coffee, and seltzer, which I like to drink seltzer. And then after we're done tonight, I'm going to have some salmon for dinner. And there are some days when I'll have, a little bit of vegetable or something, or some herbs or spices or something on my food. But for the most part, most of what I eat is meat, seafood, and poultry. I don't do well with eggs, unfortunately. I wish I did, and I don't do well with dairy. So it's mostly meat, seafood, and poultry, and I really enjoy it quite a lot. And it really helps me feel my best when I eat that way.
Wow, that's awesome.
Thank
Anyone
you.
else? We only have 3 more minutes. Does anyone have any burning questions?
I have one
Yes,
question.
go
It's a little
for
bit
it.
complicated. I once heard Dr. Finney describe how he makes his broth, chicken broth, with whole chicken or chicken parts. And one thing he mentioned, he said, don't eat the fat, throw out the fat because it's been boiled for hours. So the fat is oxidated.
Ah,
So I've started doing that. But one thing is I've had long periods where I was eating pretty carnivore, and I keep rendered fat. And I eat poultry often, and I don't eat pastured poultry. And from reading your book, I think I might be doing something wrong. I realized that poultry has a higher, and if it's not pasteurized, if it's not pastured,
Right, right.
it has a higher level of linoleic acid. So I might be eating more linoleic acid than I realize, even though I don't eat any vegetable oils. So can you comment?
Yeah, it is really sad to see how all of our foods are becoming less healthy because of the way that we're feeding our animals incorrectly. We're not taking care of our plants and animals properly, right? And so that is chicken and pork actually are pork in particular, chicken somewhat less so, but still to a significant degree. The fat in those animals is becoming higher in linoleic acid because the animals are being fed vegetable oil as part of their diets, and they're being fed, soybeans and things like that they're really not supposed to be eating. So yeah, I mean, it's not, I mean, I have the same issue. I don't eat a lot of chicken fat. I don't save rendered chicken fat, but I do save rendered duck fat. And I think the duck is somewhat better than the chicken, but still not perfect, right? So we have to do the best we can. And I think, just choose your battles, do the best you can. At least you're not pouring vegetable oil over your food 3 times a day, which is what a lot of people do, mayonnaise and salad dressings and things like that. We can't be perfect about these things. So do the best you can and try not to worry too much about every little thing. But you're correct that the chicken fat does have more linoleic acid in it than it should.
Wow. Okay, I know. This is like too fast. And I'm thinking you probably really do need to have, I think you do have a class. Can I say that? That you do offer courses, is that correct?
I do. So I have a
Yeah.
clinician training course that I teach live, but the offline version of the recorded classes, anybody can take, and it costs less. And we're actually working on trying to make it even more accessible, more affordable. That's actually something that we're working on this spring. But yes, anybody can take the recorded version of the class.
Okay. Okay. And then if someone wanted to just reach out to you as far as like, I know that we're doing great to get your time tonight, but you have a website or anything like that that people can access or anything, Instagram, any handles like that?
Yeah, so I am on social media. So I'm on Twitter, I'm on Facebook, I'm on LinkedIn, and I'm on Instagram. And so I do my best to answer people's questions on social media. Sometimes there are just too many, but I do spend time every week trying to answer people's questions directly. And I think I'm still not very good at Instagram because it's pretty new for me. So if you're trying to get a good answer, you might want to go on a different platform until I figure out how to use it better.
Yeah, that's good. I'm just going to end this with, I started my journey, I believe back in 2018, just cutting sugar, and I kept going. I kept going. And now I'm trying to figure out all the other things, right? But people will often comment about the weight loss. And I'm like, I don't even like to talk about weight loss anymore because it was my brain that really changed. And the way I was parenting and the way I was working and the type of coworker, although I was very a nice person, it was the imposter syndrome showed up a lot more, you
Hmm.
know, and the anxiety was just so much heavier. The cloud of life was heavier before just kicking the refined carbohydrates. So I just want to thank you for this book because to me, it highlights the road and the path that most of us probably need to take, but are afraid to take or just don't know how to take it. So I just am so honored, first of all, that you came to this book club, but secondly, that you wrote a book just for people to read. So thank you so much, Dr. Eve.
Well, thank you very much for sharing that story because that story is really great. And one of the things I love about that story is that a lot of people change their diet to try to lose weight, but then you get you get these wonderful side benefits of changing your diet in these ways is that your brain really does feel better. And
Mhm.
sometimes we don't even realize that it wasn't working very well. Like you know, maybe you don't have schizophrenia or bipolar disorder, you know, suicidal depression, but that doesn't mean that your brain is necessarily working at its best. And when you change your diet and your brain does better and you think, well, maybe I'm not the sourpuss that I thought I was, or maybe I'm not naturally irritable, or maybe I'm, you know, maybe I have a sunny outlook on life and it's just being covered up by eating the wrong way. And so it really is can kind of like you're describing, it can change your state of mind. And that's what I think is so amazing about it. And then the weight loss is just another good thing that happens, right? But you can, you know, the way that you go through your day can just be so much easier and more pleasant and more effective. You can be more effective, more productive. You know, you can deal with things better, cope with things better. It's not going to change, you know, if you've been through a trauma, it's not going to change that, but it can change the way you cope with it. And so people are just more resilient. They feel like they've got a buffer. They can kind of push things off to the side and deal with them when they have time. You know, it's just, it's a really noticeable difference. And it sounds like you had that experience.
Yep, I did. So thank you again. Thank you everyone who took out your time. I know everybody's crazy busy, but thank
Everybody.
you for dropping in and just, you know, making this our space to just ask the author her questions, right? She did it. So thank you, Dr. Eid. Okay, and y'all have a good night, everybody.
Thank you, Sean, and thank you everybody
Okay,
for your great questions. Great to be with you all. Have a great night.
okay.
Thank
Bye-bye.
you.